Houston COVID-19 hotline.
We are experiencing a high volume of calls. Please continue to hold, and the next representative will be with you shortly.
We think my sister has COVID, and so I'm trying to see if I also have it to figure out what precautions I need to take and how many other people I've potentially exposed. It's not been as easy as I thought, so I thought we had a lot of testing centers set up and that a lot of companies and pharmacies also had centers set up, but I guess they're all getting super full now that our numbers are going up.
Eyes up, sit back and chill, take a deep breath, and just exhale slowly.
Okay.
Start relax.
Okay.
Alright, about a few seconds and you can all show.
We spent all day yesterday driving around trying to get my sister tested, and we were not successful at all.
That's it.
Wow.
One of the things that we know, certainly in the Houston area, that cases are increasing. We've seen that over the last 2 weeks. It coincides with after Memorial Day, certainly, which was a major holiday, and we know people were out and about.
Some slight symptoms here and there, so I just wanted to get tested to make sure that I'm all right, just to be safe, on the safe side, because I work in the food industry. They don't want me to get anybody sick or anything. Some places aren't following all those guidelines, and that can also kind of skyrocket things back up to the way that they were before we reopened everything.
The governor and the state, they moved forward with the reopening plan. And somewhere in between, the state made the policy decision that local communities could not enact more restrictive policies than the state. And all of these really give people a false sense that we're back to normal. And that's our biggest concern from a public health standpoint here locally, is that any mixed messaging from the federal, state, local level can give confusion at the individual community level, that individuals in the community say, well, gosh, if they're saying different things, I'm just going to take the risk. I'm not going to wear the face covering. I'm not going to social distance. I'm not going to wash my hands. I'm going to go out when I'm sick. I'm not even going to worry about this. I'm so done with this virus. And we keep saying that we may be tired of this virus, but this virus is not tired of us. And it continues to be deadly. It continues to infect people. And so now the concern is that we are seeing a rise of cases, a rise of hospitalizations, and even more saturation in our intensive care units.
When we did open the first few days, I could definitely see people were, keeping their distance. But this is the issue. After a few drinks, people forget about that social distance. So in the beginning, the first day we had about 20, 30 people here when we opened. Everybody was spread out. Within an hour, everybody was almost pulled into the same cluster of people.
We have been just kind of out and about, seeing the sights, having a couple drinks, and enjoying the aquarium, local bars, and doing things like that. So some of them make you wear the masks, some of them won't. So I guess it's like per ownership, kind of their rules and regulations.
If you have an establishment and you are seeing 2 restaurants or 2 bars, one seems to be following health protocols, one does not, well, vote with your feet. Go to the one that's following those. You've got a choice to make as well. If you enjoy your life the way that we previously enjoyed our lives, we're going to see an overrun in our healthcare system, and unfortunately people are going to die.